Good afternoon. Thanks to everyone for tuning in to today's updates from the Health Department. Today, and some information that we just heard from the governor. Obviously, we have some good news and we have some bad news, I guess, depending on how you look at it. Good news is we're continuing to expand opportunities for our citizens in the area to be tested. Monica is going to give us more details on the testing numbers, but I think suffice to say that we're going to have a lot better metrics to help us understand the breadth and depth of where coronavirus is in our community. I think many of us are a little disappointed to hear that the governor's executive order is going to be extended. I need to tell everyone that in addition with Chairman Rand at Peoria County, and I'm sure the same is for Tazewell and Woodford County, we're having daily, nearly, conversations with our state rep, state senator, about where the business community is and how strongly they feel the need to try to figure out how we can get them open back up. We're expressing that through them. I've been on numerous calls through the board of the Illinois Municipal League, which I sit on, other area and statewide mayors. I do know that the governor is hearing loud and clear that the business community wants to get back open. The governor is being very methodical about this. He is erring on the side of medical science. And I think that once we have more time to understand where our local numbers are, we're going to have a little bit broader knowledge of specifically how dangerous this area is, and perhaps give us some talking points with the governor and his staff in a couple more weeks in terms of if there is a potential opportunity in our state to allow different areas of the state to perhaps have a more relaxed rules. I do want to urge everyone to continue to comply with the governor's executive orders to shelter in place. If we are to be at a point where we can at least make a strong argument to the governor and his staff that this area is better insulated than areas of more density, I think it's important for us to be able to show that we continued to stay in compliance with the order until we got to that point. I think we have absolutely no leverage with the governor's office if there's just a bunch of Mustang rogue folks that just decide, hey, we're going to do it in spite of the governor. And if they don't see the continued diligence to try to keep this under control, I don't think we're going to have the consideration to eventually loosen up the stringent requirements that we have placed on us at this time. So I just ask everyone, as hard as this is, we are making progress, slow but sure. Again, Monica's going to give us a little bit better taste of where some of these numbers are, but at least we're going to have some real metrics to understand where we are here locally. I can tell you that, especially to the small business people that are getting crushed, the city is getting crushed too. We're getting no financial assistance from the feds, and the numbers that the city manager and his team are crunching right now to bring back to us Tuesday night are the most staggering numbers I've ever seen at this level. And the potential impact that this could have on our community is really distressing. So we feel your pain. We're as anxious to get out of this and get the economy coming back, but we have to continue to comply and keep this contained so we can get to that point. Now to Monica Hendrickson.
Thank you, Mayor Ardis. I'm going to begin with discussing the to-date totals for our Tri-County region. Today marks the largest increase in cases for our Tri-County region with 12 new cases. That includes 53 in Peoria County, 32 in Tazewell County, and 11 cases in Woodford County.
Wait, how many?
53 in Peoria County, 32 in Tazewell County, and 11 in Woodford County, reporting 96 cases total. There were no reported deaths at this time. Of the 12 new cases in our Tri-County region, 6 were identified through the Heartland Health Service drive-through clinic, which I think reiterates the fact that such increased testing is imperative to, as the mayor spoke of, understanding the scope of COVID-19 in our community. As the increased capacity continues, as well as restrictions in terms of who can be tested get lifted, more and more people taking advantage of this is really a great way for us to understand where we sit as a community. Specifically in regards to the 53 cases in Peoria County, 32 are recovered, 12 are at home and isolating, 7 are hospitalized. 59% are female, and again, our 3 largest age ranges are the 50 to 59, 60 to 69, and 30 to 39. In terms of racial demographics, whites make up 55% of our cases, and Black African American make up 38% of our cases. In our hospital data, currently there are 17 ICU beds in use, 9 for persons under investigation and 8 for confirmed cases, and 9 non-ICU bed is at 34. I'm also pleased to report that by 3 p.m. today, Heartland Health Services completed another 150 tests at their East Bluff Center. And we're looking forward, as many of you saw when you walked in to our area, the tents are up here to start our test site here on Saturday as well, and we're hoping to see another 150 as well. Well, I know there's going to be a lot of questions and discussion about what the executive order means, as well as some follow-up questions for how the city of Peoria is handling this as well. I think one thing we want to reiterate is that the extension of this stay-at-home order is really to help protect those vulnerable populations. And to kind of speak on how the impact of COVID-19 has been to these vulnerable populations, we have with us our Executive Director for Advocates of Access, Jeannine McAllister.
Thank you, Monica. I'm Jeannine McAllister with Advocates for Access. What we are is a Center for Independent Living. We are comprised of all staff and board members. 51% must have a disability. And we've worked closely with Jason at the Health Department in the past on emergency planning. So we're part of the calls that go on dealing with the vulnerable populations. I want to share some of the services that we do currently, as well as talk about 2 new programs because of COVID-19. Every Center for Independent Living offers information and referral services, peer mentoring, advocacy, independent living skills training, and transition. Transition can be out of secondary, out of a high school into secondary or to employment. We also transfer or transition individuals from nursing homes back into the community to live independently. That obviously has been on hold right now with all that is going on. One new program the state very wisely reached out to Centers for Independent Living was to establish an emergency personal assistant program. We have about 30,000 individuals in the state of Illinois that are under the Home Services Program, meaning they qualify through a determination of need assessment to have someone come in their home and help them with activities of daily living. We don't want this stay-at-home order to have those individuals stop receiving their services if a personal assistant doesn't show up. So all centers in the state of Illinois have entered into a contract, an emergency provider contract, so that we can really streamline the paperwork that has been required in the past and get someone immediately into that home. We also don't want the individuals who do not have their personal assistant show up, calling 911 to help them get out of bed, can't get their medication or get their meals. So this is a nice alternative to set up for them. The other issue that we have, which is a very positive one for us right now to assist people with disabilities, is the COVID response funds. So in the past, if somebody had called us needing assistance with rent, we would refer them on to another provider in the community. if they have a disability and they are affected by COVID-19, we are now able to officially help them with the cash to stay in their rent, to get groceries, any nutritional items that they need, or pharmacy items as well. So it's been a really great collaboration working with Jason and Monica, those at the health department. We've gone back many years in emergency planning to make sure individuals with vulnerable needs are included in all planning. And so I'll turn it back over to Monica. Thank you.
So we'll open it up to questions. We'll actually begin with, does anyone have questions for Jeannine? Yeah.
So I know one of the issues that's brought up a lot with continued mask wearing is, those that may have some hearing difficulties that they're not able to read lips. So kind of if you could talk about some services that are maybe available to help those individuals, or recommendations kind of for everyday people to help those who may have some hearing difficulties.
Definitely. A mask with anyone trying to read lips, and even the information they get from reading lips is not abundant. Some are very good at it. Any facial hair is going to interfere with that as well. But I go back to what Monica said about the social distancing, maintaining your distance if you need to. Other means of communication as well, pen and paper if there's not an interpreter around to have that communication with them. If I can add one more thing real quick. We do have a loan and loan library. We are open for service curbside. So if there are individuals that are in need of a walker, a wheelchair temporarily, crutches, a commode, if we have it, these items are donated to us. We are still giving the items out to people because the need is still very great out there. We have depends. We have people coming to pick those up as well. So we are still taking those calls, and we will have you call us when you get to our parking lot and be happy to take out any of the durable medical equipment that you might need.
Thank you, Jeannine. Do you have questions for Mayor Ardis or Patrick? No? Okay. Okay, well then, let's start.
It is all you. Could I please ask, do you have a breakdown of the site has now done about 450 cases, give or take. Can you tell us how many of those were from the city, from that area and other things?
So the question is, in regards to the testing sites that Heartland is operating, do we have demographic breakdowns as well as locations of test sites? We are working through that. The issue right now that we're having is that the laboratory does not have electronic laboratory reporting, so it's manually being entered. And one of the great partnerships that Heartland Health Services has worked through is University of Illinois College of Medicine, Peoria. And so they'll be actually doing a lot of the analysis in terms of that demographic information. We had our first after-action call yesterday after the first site. And then again, on Monday, we had one again the other day, and to kind of try to see where we're sitting with all of this information. And so hopefully we'll be able to start presenting that as well on our briefings and put that out in a press release. But we are monitoring that just kind of through conversationally. Majority are coming from the Peoria area, city of Peoria, Peoria County, and then we have seen all the way from Pekin, Washington, Metamora as well.
Monica, as he was just mentioning, hundreds of tests given out, which is good that we're meeting that capacity. Only hearing that 6 of those, positive results that we've gotten from that, kind of what is your reaction to that? Is this, good news that, maybe it's not as prevalent in the community as we might have thought, or what's your interpretation of those results?
So the question is, thinking that we've only done 150 tests and gotten the results back with 6 positives, what does that really indicate for us? It is a little bit too soon to tell. I think what it does show, though, is that recognize the fact that these individuals were driving their car to a test site. They weren't hospitalized. And primary testing had been focused on those individuals that were being hospitalized. So the fact that you had 6 that had mild enough symptoms that they were able to still kind of go about their day, include drive-through clinic, demonstrates the fact that a lot of people have it. They may not necessarily recognize their symptoms to its full capacity, but that increased testing, you're going to be catching individuals that the prior type of testing was not necessarily catching when we were doing that. So expanded testing, you're starting to get more people. And remember, with those 6 individuals, now that's that contact tracing we talk about. How many people have they been in contact with, following up with them, monitoring their cases as well. So 6 people and all those confirmed cases are always going to be a small number with the work that goes behind it to actually monitor all the contacts.
So to follow up on that, how long does it take to get an accurate picture? So I mean, if we saw 12 today and 6 were from the Heartland testing site, I mean, how long do we have to go before we say, okay, here's our guesstimate or of how many there actually are in our community based on the data we've gathered for X amount of time?
So the question is how much data or more testing do we need to kind of understand where we sit as a community? And I think I would actually refer to the governor's conference just this afternoon, where even after having the data since March really and April, it was giving us a better understanding, but not a perfect picture. And so I don't think we'll ever say that we have enough to make that accurate decision. Having said that, we are finally getting expanded testing in our area, and I think that's going to be the number one tool that we're going to start utilizing to start monitoring what the general symptoms are in our community. And so I think it's too soon to tell, and I would implore people that, remember, come May 1st, it's still a stay-at-home order. It's just extended, and there are some restrictions lifted, but we still are asking people to stay at home. Because from a contact tracing point, when we still get those positives, instead of trying to hunt down 50 or 60 people you might work with or see on a day-to-day basis, it's going to be much more limited, so we can still do that controlling and contact tracing, which is a key part of controlling this virus.
So what kind of numbers are we looking for that we can go to the state and say, here we've had this number of cases test positive for this amount of time, to make the argument that it's time to begin lifting restrictions and begin a regionalized reopening?
That's a great question about what do we feel is a comfortable point at we can kind of start talking that discussion from a region with the state. I think knowing that this has only really been our first week of community-based testing, it really is going to be 2 to 3 weeks before we fully understand. And from the models that were presented today during the briefing with the governor, we're still going to see that plateau and that peak late April into May. And so this is, it's good that we're able to start relaxing some capacity, but it doesn't mean that we are clear to go and kind of return back to normal. It's going to be closely monitored because, as the governor said, and even our data, and we're going to monitor it even further, is that we don't want to have to go back to full self-home with stay-at-home policies, kind of that really extensive intervention versus much more relaxed. And so take this opportunity to respect the fact that we have these ability to do that, but it is still a stay-at-home order until the end of May.
Monica, as soon as it was announced that there would be an expansion through May, social media was immediately flooded with questions like, Peoria doesn't have near as many cases as Chicago, so why is Peoria and surrounding areas still under strict restrictions?
That's a great question about why here regionally we're still under those restrictions even though our case numbers, and it goes back to the fact we're only now just getting this amount of testing that Chicago has been seeing. And so we're still in a diagnosis phase, if I can say that, in terms of what it is in our community. With limited testing, we were again prioritizing those individuals that were high risk, very vulnerable, where the test mattered and made a difference in care. Now we're really focused on understanding what that full picture is so that we can look at those restrictions being lessened through time. But again, this is only the first week we've had that type of testing here locally. And so it's still really early. And again, we just want to keep monitoring it. Because, I'm with a lot of people. I would really like to go out and, do what we kind of did back a few months ago. But at the same time, it's going to be really hard to bring everyone back under stricter restrictions as well. So we want to take our time, use data, use science, and make an accurate decision.
Not sure if you would know this based off of not necessarily knowing exact as to where these People are coming from, you know, a lot of the talk around putting these testing sites in these specific places were to help kind of some of the at-risk populations in terms of minority communities. Are we seeing it really helping those communities? Are we seeing them coming out to these sites?
I think Heartland Health Service has recognized that a lot of the individuals coming through their test site are, you know, patients of theirs, which Heartland, as a federally qualified health center, really can see anyone. It's a great resource that we have in our community. We're actually very lucky to have a federally qualified health center in our community. And it's not just only Peoria City or Peoria County specific. They actually have offices in Pekin, and they cover Tazewell and Woodford, and I think they can reach also into Mason and Fulton. And so, you know, their scope is very large. Again, to have those in those neighborhoods connected to an existing federally qualified health center, so on their 3 locations, the health department being one of those locations too, is a way for them to be able to, you know, utilize their services. It's a location that is embedded in those vulnerable populations, because part of being a federally qualified health center is making sure you're serving the community at need. And so where they are located matters. And so transportation access, good parking, and again, those high-risk neighborhoods, that's why those clinics are located there, and having the test sites connected to them makes sense. And so I think we are seeing population coming from that number, and as the University of Illinois College of Medicine continues to kind of crunch through that demographics, we'll get a better understanding of it too.
As far as,
Oh, go ahead, Amy.
sure?
Yeah.
All right. As far as the test goes, we have heard many things about the types of tests, how good the tests are, how bad the tests are, false positive, false negative. We have been through 450 tests because they've done up to the amount each day. We've had 6. Is this a sign that you feel that the tests are working and it's really off of what someone else said? Or is this are you worried that maybe these tests are not as strong as maybe that we would like them to be? What type of tests are these, and what is the accuracy rate?
So the question is regarding how confident we feel about the accuracy of these PCR tests. And because testing goes through not only from the FDA, but even the state health department validating the test and the type of test, and the lab that is in question, the one in Pekin, was also utilized by one of our large healthcare providers. They did their due diligence to make sure that they not only tested them, but checked for accuracy against blind studies to make sure that the information was being accurate. So we feel confident about the test. I don't think that just by saying there's 6 out of 150 is an indication that we have a low community transmission. I think it highlights the fact that, again, these are individuals that were able to drive their car, come into a test site. So the amount of mild symptoms that we have in a community indicates that testing and community-based testing is warranted to, again, catch those individuals who might think that I always have a cough this time of year, or I might be suffering from another comorbidity such as I have asthma or I have COPD, and so they may not necessarily realize that their symptoms are actually being masked by other symptoms. And so that's why community-based testing is going to be really imperative. And so if possible, and you feel like you have one of those mild symptoms, take advantage of the 3 different sites. The East Bluff is live right now. The health department will be active on the weekend, and then next week they'll open their 3rd site as well.
So I just wanted to follow up on Caitlin's question. So when the Peoria County Health Department first began releasing the racial demographics a week or 2 ago, it was about, I want to say the amount of African Americans was about 29%. Now we're somewhere in the high 30%. So the ratio has gone up. Is that due to more testing? What can we attribute that to?
I think we can attribute the changes in the racial demographics to more testing availability, as well as the fact that we are targeting in our highly vulnerable populations. And so I think it's kind of a little bit of a mix in both senses. And I think there's been a lot of energy and discussion around race and health issues. And we've had some excellent speakers here, Dr. Nyala, Pastor Hightower, Representative Gordon Booth, to really focus on the fact and the importance of recognizing the need to test. And so I think that message is getting out, and I think more people are wanting to get tested. And so I attribute that as also an awareness. And so again, thank you for sharing that message as well.
Could I please follow up on that hit? How much of this too could also be due to the fact that up until very recently, only a doctor could order a test, and many of these people who are highly vulnerable population might not have a normal PCP. Is that have you guys looked at that, and maybe in the weeks and months moving forward, is there going to be a drive to try to get specific areas to go more to a primary care doc?
So the question is, does this also kind of link towards the fact of the ability not to have a PCP or have a healthcare provider that you routinely see? The earlier testing was more towards hospital-based testing, and now community-based testing, you can still have a PCP, but you don't need to have a physician referral to get tested. And so I think this expands the scope of individuals that get tested, as well as allows individuals to get linked to care, because one of the follow-ups that happens is that your primary care provider will get that you give a name for, will actually give you the results or be notified about your results. If you don't have one, Heartland will be stepping into that role as well to get you linked to services. And again, I can share how great Heartland Health Services is as a partner. They're actually going into those really high vulnerable populations, homeless shelters, transient populations, to start creating baseline data for health, recognizing the fact that if you don't have a primary care provider, you might not have been in the earlier phases of this response being tested because you didn't really know how to access the system. Now with telehealth, as well as 211's expanded reach and the community-based testing, I think more people are being able to get tested as well as getting linked to healthcare services.
Monica, do you have a comparison as to, say, the number of people that were being tested before these sites were opening up, when it was very restricted, as opposed to now? Do we have a comparison number, say, for Peoria?
We don't have a comparison number necessarily for people that were tested prior to today, again, because we really have this is week 1. We know what that line is in our data, and so we'll be monitoring that moving forward. But again, we don't, it's too early to kind of make a true comparison, only having been open. Today is the 3rd day for their site, so we would only have 3 days worth of data. And remember, Heartland is able to see a large region, so you don't necessarily just have to be Peoria City or Peoria County. Again, this is going to be a regional community-based test site.
So then these six sorry, Andy, just to clarify, these 6 positives that we saw from the testing site, that's just from the first day, correct? So that was just from the first 150.
That was exactly right. The first, the 6 that make up half of our new cases are just from that first day on Tuesday only.
So I just want to make sure to follow up on that. So when I kept saying that it was 6 out of 450, you guys don't have the results back from the 2nd and from the third day.
That's correct. The 6 that we spoke of are for the ones that were tested on day 1. Day 2 test results will start coming in tonight and early in the morning, and then we hope to keep continuing that process on.
When did it get opened up to everybody? Because I thought on the first day that it was still those 4 groups of people. It was age-based. It was prior health issues, whether you showed signs or symptoms. So therefore, was it more on the first day that it was more of a restricted pool, and the 2nd, 3rd day are going to be more wide open?
Yes.
Am I right or wrong?
That's correct. So the first day of testing was still those 4 priority groups, but then on the 2nd day of testing, the Illinois Department of Public Health expanded testing to say individuals that can that have symptoms, present with symptoms, as well as have the ability to have the test administered to them, not them doing it to themselves, but that they are kind of an adult, can sit still and have a test be done. They were able to start doing those yesterday and today. The news came out, I think, midday yesterday, so really today's testing is the first full day where there's really there should be no questions about the fact that if you are over 18 and you're able to get the test administered and you have mild symptoms, you can show up to one of the sites and get tested. So.
Part of Governor Pritzker's expansion beginning next month is wearing masks will be required in places where maintaining a 6-foot distance might be kind of difficult. what are some options? Because sometimes it's not always easy to just go out and get a face mask. What are some options? And are you guys still kind of enforcing using gloves out in public?
So the question regarding what the governor mentioned about when you're unable to maintain that 6-foot distance, the requirements to wear face masks. And that's really primarily in the workplace settings as well. And so I know a lot of employers, ours included, are talking about how do we maybe expand or change our shifts as well so that we can spread out staff. But I think when we talk about face coverings, we want to make sure we understand fully, because there's a lot of people in a lot of positions, and so some will require those high intensity N95s based on the work they do. Others can wear a face mask or a cloth one as well. And so we are waiting to get more details from that executive order to be able to kind of fully formulate a guidance on that. On your question about the gloves, gloves are always going to be utilized and important, but just remember also that hand hygiene can't replace that. I mean, you want to always wash your hands as much as you can.
What is the end game here? And what I mean by that is, I think Mr. Shelley back there asked, how many people do you want to test? You're never going to be able to test every single person. You're never going to be able to have a snapshot on one day of what everything looks like. Mm-hmm. There are some people who would say, and it might be me, that barring an effective treatment and or a vaccine, that we're just as much at risk in a month as we are now, as we were in March. The Spanish flu pandemic, the second wave was much worse than the first wave. The question is, what is the end game here? We are taking all these numbers and we're finding out all these cases, and the numbers I'm sure are going to spike. But in the very, very end, what are we trying to find out? And I get that we're trying to find out what it looks like. But what are you hoping to find out so that the average person can say, okay, it's safe now?
That's a great question about what does it look like in terms of an end game. I think the first thing to recognize the fact that without an effective medical intervention such as a vaccine or treatment, so to speak, there is no such thing as zero risk, especially with viruses that can mutate. There is no such thing as a zero risk game. And so it's really a phased approach about how do you kind of come back online in a way that maintains the health and safety of our community. So right now we're in the phase of how big is our problem? And the best way to understand that is testing. Whether it's testing people that are sick right now or getting antibody testing available to see what that immunity looks like. And even antibody testing, again, I know a lot of people have been seeing it in the news, it's not been fully vetted, and it only tells you whether or not you have antibodies. It doesn't tell you whether you are immune to get reinfected, what will be your response afterwards. We know for viruses in general, if you've been exposed to it and recovered, if you get it again, you tend to have either milder symptoms. But that's not necessarily a given with COVID-19. We're learning that COVID-19 doesn't like to play with a lot of the same rule books that other viruses do. So really, in terms of the end game, you're not going to go to zero risk ever, especially when it comes to the virus, but you're looking at doing it in phases. So the first phase is understanding how big of a scope the issue is. Then from that phase, understanding who is our most vulnerable population. We understand it's elderly, people with comorbidities, individuals living in congregate living settings. But then how do we protect our most vulnerable populations? And then again, when we have a vaccine or a treatment course, how do we properly distribute that as well? And so it's going to be a phased approach more than anything. There's not going to be a finish line. It's not a marathon. It really is an ultra marathon. And I think of public health a little bit in this conversation because we might come out in the winter and feel like we're back to normal a little bit. We're having holiday get-togethers with family members. We understand the risks that individuals have. But remember that public health is going to still be contact tracing. They're going to still be looking at positive tests. And then when it comes to vaccines, when we learned from H1N1, large vaccine clinics were being done through your local health department. So that's something where we're even thinking of in 2021. So how I see it compared to the general public is going to be slightly different because this response for local health departments are over 2 years in the making right now. And so I think it's going to be phased. There's never going to be a time that you feel like there's zero risk. But I said it yesterday, I believe, I'm going to say it again. One of the biggest things you can do coming into the fall is get a flu vaccine. It's going to be imperative. And it's, again, not only to protect yourself and those around you, but also to protect our healthcare system as well. And so I wish I had the answer. I really do, because I think that would make my life easier as well. But we have to recognize the fact that as viruses work, this is going to be a phased approach to getting back to normal, and there's going to be different markers and different milestones based on each phase. And right now, the phase we're in is understanding the problem, and that means testing, testing, testing. With that, I will see you guys tomorrow.